Do you ever find yourself worrying about things that might happen in the future? Do you ever feel a tightness in your chest that makes you feel like you're having a heart attack? Have you ever tried to find ways to get rid of your anxiety, but found that it actually gets stronger? If you've ever gone through this, you know how debilitating anxiety can be, and you may be at your wit's end about what to do about it. So in this video, I'm going to talk to you about a therapeutic approach that's been found by thousands of studies to be effective in addressing all kinds of anxiety disorders. Now is always the time to start making positive changes in your life. Dr. Donna Leigh Bliss here. On this channel, I promote optimal mental health and well-being to help you become the best version of yourself. Please help me to grow this channel by clicking on the subscribe button. While the experience of anxiety is something everybody goes through, for some people, the degree of anxiety can be so debilitating that it's hard for them to really live their lives. According to the Anxiety and Depression Association of America, anxiety is the most common mental illness in the United States, affecting 40 million adults. Yet, only about 1/3 get treatment for it. If you suffer from an anxiety disorder, you might wonder what therapy is best to help treat anxiety. If you do a Google search on psychotherapies, you'll find that there's about 400 different kinds. How would you know where to start? Which ones are best for anxiety? Well, the good news is that this work has already been done for you through research over and over and over again into the effectiveness of various types of psychotherapies dealing with a whole host of mental health issues, including anxiety. So evidence-based practice involves reviewing, analyzing, and implementing scientific research on the effectiveness of treatments. This helps guide clinicians like myself use treatments that have been found through research to be effective in addressing certain disorders. So that way I can be confident that I'm providing my clients with the very best possible care, and they can feel confident that they can actually get better. According to the Mayo Clinic, cognitive behavioral therapy is the most effective therapy for the treatment of anxiety disorders. There have been countless studies done on cognitive behavioral therapy for many different issues, but studies have shown over and over and over again it can be very effective in helping to treat anxiety disorders. And cognitive behavioral therapy is particularly effective because it focuses on two aspects of human beings and our functioning. One is our thinking. So what is the thinking that we have and the beliefs we have that can contribute to anxiety? The second looks at behaviors. What kind of behaviors are we engaging in that actually create anxiety or make it worse? So from a therapeutic point of view, it helps us to target two specific areas of human functioning and do that in ways that can help people start to feel better. According to the American Psychological Association, cognitive behavioral therapy is based on several core principles, including 1, that psychological problems are based in part on faulty or unhelpful ways of thinking. 2, that these problems are based in part on learned patterns of unhelpful behavior. And 3, that people who are suffering from psychological problems can learn better ways of coping with them, and this helps to relieve their symptoms and help them become more effective in their lives. So cognitive behavioral therapy typically involves efforts to change thinking patterns. Strategies that include learning how to recognize distortions in our thinking that create problems, the tendency to make small problems seem bigger than they are. It helps us to get a better understanding of our behavior and our motivation. It can help learn problem-solving skills to cope with difficult situations. And it helps people learn to develop a greater sense of confidence in their own abilities. Cognitive behavioral therapy is also helpful because it helps to address behavioral patterns. And so strategies can include learning how to face fears instead of avoiding them, and learning how to calm one's mind and relax one's body. One approach I really like to use with my clients is exposure therapy. When I work with clients, they commonly talk about issues they feel anxious about, and while they're just talking to me about them, I notice that they have anxiety spikes. Their speech speeds up, their facial expressions change, they talk faster, and so they're having a visceral reaction to just the idea of something, even though they're not being exposed to whatever the scary thing is, whether it's a fear of heights, or a fear of a certain kind of animal, or a fear of public speaking. And so one of the ways that I use cognitive behavioral therapy is when we're talking to help them identify what are the thought patterns and beliefs they have that's generating the anxiety. So I have clients that have social anxiety, so the idea of public speaking terrifies them. And it's interesting, when we start talking, they'll have an anxiety spike, and we'll look at what was the thinking involved. And it may be they remember a time when they felt embarrassed in public speaking in a class or something. Or it may be just their imagination that they're picturing themselves sounding stupid and feeling humiliated, even though that's never happened. So we start off by beginning to address those thought patterns, help clients learn how to relax more, usually by helping them learn deep breathing. And slowly, the anxiety that they're feeling about just the idea of public speaking starts to abate. And so the next step might be then to get information on public speaking. So I have a client that is terrified of having to give presentations at work because she thinks she's stupid, and she just imagines that people are going to think that she just doesn't know what she's talking about. The reality is she's very intelligent, but she has quite a bit of self-doubt. So we started off with exposure therapy, with talking about speaking at work and just how anxious she'd get talking about it, but her anxiety level started to get lower. So I upped the game a little bit. I said, well, what do you think about the idea of getting information on Toastmasters, which is an organization that many people use that helps them learn public speaking skills? I thought this would be a great way for her to start to address her fear of speaking in public. Well, at first, just the idea of Toastmasters, she shut it down. She said, there's no way I'm going to do that. So again, I noted that we're just talking about it. We're only talking about getting information. She doesn't really have to do anything with the information. And so her anxiety started to abate because she started to see how her thoughts about Toastmasters, what she was believing about being involved with that was going to mean in terms of being embarrassed, that was generating the anxiety, because the reality was she was just talking with me. And so I encouraged her for the next session to get information on it. And I wasn't sure if she was going to be ready to, but she did. And she came back and she seemed to be a little more confident of herself and talked about how she realized that she was just getting information, that she didn't have to be anxious about getting information. And so we then talked about, what does she think about the idea of going to a meeting? Again, she had an anxiety spike because the idea of a meeting triggered her fear of being humiliated in public. So we worked through that again by identifying her thought patterns, helping her to relax by breathing. Her anxiety went down. And she said, well, maybe I could go, but I'm not sure. So we talked about if she went and if she felt uncomfortable, she could always leave. So she wasn't going to be trapped there. And so the next session she came back and she said, you're not going to believe this. I went to a Toastmasters meeting and I liked it. I even talked a little bit. And so we then went on to talk about getting more involved in the program, being intentional about public speaking, which is facing her fears. And she got better and better and better at it. So exposure therapy is just one application of cognitive behavioral therapy that is very powerful in helping to relieve anxiety symptoms. With over 30 years of experience as a clinical social worker, I know firsthand that cognitive behavioral therapy is very effective in treating anxiety disorders. I use it with my clients all the time, and I've seen over and over and over again people's lives start to improve dramatically when we use cognitive behavioral strategies to work with them. So I encourage you to check the cognitive behavioral therapy out if you haven't done so before. And I'm sure that you'll start to feel relief from your anxiety symptoms when you start experiencing how powerful and effective cognitive behavioral therapy is. Thank you for watching this video. I've included some helpful resources in the description below. If you like this video, please click on the subscribe button so that you can be notified when I release videos on other issues around mental health and well-being. I've also included some links for other videos that I think you might find helpful. Remember, now is always the time to start making positive changes in your life. I'll see you next time.